Hello everyone, welcome to another presentation of the kind of life-changing work that my team and I carry out at London Dental Specialists on a routine basis. If you like our videos, please subscribe to our YouTube channel and also follow us on Instagram and Facebook at London Dental Specialists. So let's get into today's presentation. Actually, today and tomorrow, I'm going to present two patients with exactly the same problem, all right? But the same problem is treated differently. And I hope that a combination of the presentation today and the presentation tomorrow shows the solutions to a phenomenally common dental problem out there in practice. I'm sure your dentists are seeing this on a daily basis and they are talking to you about these issues on a daily basis. So watch today's video and tomorrow's video together to get a full picture of the considerations in respect of how we manage a problem where there is decay or a fracture that extends underneath the gum. So this first patient, 33-year-old male, was referred to me for that very reason. Fractured tooth of the upper left second premolar. And you can see here that is a temporary filling that has been placed, and you cannot see it clearly on this picture, but there is a huge hole that extends underneath the gum right there. So this is the upper left second premolar. This dark area is not here and it's not here, and that's the area of fracture / decay. And the bit that you cannot really see, again because an x-ray is a two-dimensional representation of a 3D space, is that you cannot see in detail how far down underneath the gum this goes. But I reassure you that the fracture extended to the level of the bone on the palate surface of this upper left second premolar. So this is the palate, this is the cheek of that tooth. So the problem again is tooth fracture underneath the gums. What are the solutions? Option 1, to save the tooth, requires crown lengthening surgery, root canal treatment, and a crown. Option 2 is a replacement with a dental implant. Now, the main thing that we need to be aware of is, 1, how strong is this tooth if we're going to invest time and money in trying to save it? And 2, do we need to remove the bone in the area as part of this crown lengthening surgery? Because if we do need to remove the bone in this area as part of crown lengthening surgery, which was required in this case, then quite frankly, that tips the balance in my view to a dental implant, because a dental implant needs the bone that you need to remove to save the tooth. Now, if the tooth in itself was particularly strong, great, we can take the risk of removing the bone. But if the tooth itself is not very strong, remember it's fractured in the first place. If the tooth itself is not very strong, then I'm sure you can begin to see that spending time, effort, and money on this particular tooth to save it, only for it to break again within 6 to 12 months, may not be very sensible. Now, please be aware that this gentleman came in wanting to save his tooth. He was referred in for the crown lengthening surgery, and it filled me with great joy when he came in. I discussed the options with him just as I've just discussed them with you, and he completely changed his mind. He said, look, there is no way I'm going to invest my time and my money in this kind of treatment only for it to fail within the next 12 months. And I said, look, that makes a lot of sense, and that's why I went through the options with him the way I did. So let's see what we actually did. He went for the dental implant. So what do we need to do? What do we need to be aware of in respect of the dental implant here? This area, this dark area here, is a sinus in the upper left, which I have shaded in blue. And this is the level of bone inside his mouth. Basically, there isn't enough bone height. There isn't enough bone height for a dental implant. And so what we did is to place a dental implant, but also at the same time do a bone graft into the sinus. And that's what is shaded here in yellow. And that is a very straightforward and relatively predictable procedure to do. This is the final beautiful tooth made by Unica Dental Lab. And how long did all this take? It took 12 months. But COVID-19 did delay us. It would probably have taken about 7 months otherwise, because it takes 6 months for the bone graft to heal. It cost him £3,500 because of the materials, the laboratory, everything that we use. We are very confident in the result, and therefore offer a 10-year warranty on all our dental implants, and finance options are available. Our job in London Dental Specialists is to take out all the worry from the patient, because we're the ones that are trained to understand the little nuances, and give a patient a very simple maintenance plan. And if they follow it, the chances of anything happening over the next 10 years are pretty slim to nil, because of the way we've set up the whole case. So why not pick up the phone and give us a phone call to refer yourself, or speak to your dentist or your hygienist about your dental issue, and we'll be only too happy to hear from you and look after you. Join me tomorrow to see a completely different way of dealing with this exact same problem. Many thanks.